You're watching continuing coverage of the World Healthcare Congress 2012. In the studio, we have Dr. Ezekiel Emanuel, who was a long-time proponent of healthcare reform and was actually one of the chief architects of the Affordable Care Act that was signed by the President in 2010. So here we are, 2 years later, and what has really changed?
Oh, well, a lot of things have changed. First of all, just from the bill's perspective, things like kids under 26 getting on their parents' coverage. That's given health care insurance to 2.5 million children, and another million have upgraded their coverage. The donut hole is closing, so a lot of seniors have gotten additional coverage for drugs. A lot of people now get free preventative care. We have some high-risk insurance pools. Plus, everyone is gearing up for the introduction of the exchanges, so there's been a lot of work on establishing the exchanges. And I'd say if you go out to hospitals and physician offices, there is a lot of movement and activity around things like reducing hospital infections, reducing readmission rates, improving quality, figuring out how to be much more efficient. I actually think there's been a huge amount of change. A lot of it is a little under the radar. I would also say that in the health information technologies, the electronic medical record, there's been a lot of uptake by doctors and hospitals, a lot of companies formed to develop new apps for health information technology. So if you ask, has there been a lot that's changed? Well, maybe it hasn't been noticeable just yet to everyday patients, but there's been a huge amount of change in the health sector.
Back to the exchanges for a moment. States like Utah and Massachusetts have gone it alone and decided to put their exchanges up and running. Is it risky for more states to do that, given that there is definitely some concern that this law is not legal?
Well, I think most states that are going to wait till 2014 when the subsidies kick in, and I think the mandate will be declared constitutional by the Supreme Court. But even if the mandate isn't declared, the Congressional Budget Office has estimated that 16 million additional people will come into the health insurance market, first of all. Second of all, a lot of states with the Affordable Care Act, even if the mandate doesn't hold, could pass their own mandate. I mean, you could imagine Minnesota, Vermont, maybe California, Wisconsin, other states passing the mandate at a state level. And so I think there ought to be a lot of activity around the exchanges, just because I think the court's going to uphold it. But even if the mandate is ruled unconstitutional, there's a lot of ways that people are going to come into the system. Remember, for many people, it's a financial barrier. The subsidies provided as part of the Affordable Care Act will be able to have them overcome that financial barrier. And I think it's going to change a lot of people's attitudes about health care. If it's easy to get, if you can shop for it, if you don't have to worry about pre-existing conditions knocking you out or getting you a high rate.
Is there any noticeable impact that uncertainty has on specialties like, say, oncology, where treatments are very, very expensive, and we talk about making healthcare affordable and manageable in costs? So when you look at a specialty like oncology and the treatments, how do you make those two live together?
Let me answer the uncertainty issue. I think one of the problems that has crept in is some uncertainty about what part of the law is going to go into effect. Even on the cost control measures, some of them are pilots and you're not sure whether they're going to be generalized. You had a presentation here on bundled payment. Well, there are 10 pilots proposed in the bill, so you don't know which one's going to be introduced. So a lot of people, I think, are going to stay on the sidelines. Similarly with the accountable care organizations, while they did certify 27 just last week, and they have another 150 for July, I think many organizations are staying on the sideline waiting to see how serious this is. So the uncertainty, I think, has left still some people sort of not fully engaged in the efforts to reduce costs and improve quality. As far as any particular specialty, I do think that there is some uncertainty about people want to do the right thing. I've talked to a lot of docs, and they know that the system's changing. They want to figure out how to get costs out of the system. They're not sure how to do it, and they're not sure whether they're going to be paid to practice keeping people healthier and paid for efficient care. So I think that uncertainty is a worry, and is preventing doctors from fully implementing what they think they can do.
Okay, so given that, are there during this period going to be people falling through the cracks? If you have docs not sure, they want to do the right thing but don't have the tools to, perhaps, are there going to be people who aren't going to be treated in the most efficient manner and maybe in the most appropriate way?
Yeah, I think that is probably less likely to happen. The fall through the cracks that worries me is the situation of, well, you know, we're going to try a variety of things and some of them are going to fail, in that you might have an accountable care organization that ends up going belly up. And then you have all those patients, and where do you put them? I think when you try experiments, you have to anticipate you're not going to be successful 100% of the time, or necessarily even 50, 60% of the time. And so in those situations, we do need a good safety net to catch people. The worry about patients not getting care, maybe not being able to get to their doctor, you know, in Massachusetts, when they expanded coverage and got a lot more people in the system, they did not see an increase in waiting times. They did not see an increase in problems. As a matter of fact, they saw a decrease in the emergency room visits, and the waiting times for primary care doctors and specialists like cardiologists were not any different. So the sort of fear-mongering, oh, it's going to be impossible to get to a doctor, we don't have enough workforce, I think that is very unlikely to pan out.
Okay, Dr. Emanuel, thank you so much for your insight.
No problem.
Really
Thank you.
appreciate it. I'm Abel Jong. Thanks for watching.